Hey, what's up? Our channel is presenting a brief description about what actually is depression.
Depression is the leading cause of disability in the world. In the United States, close to 10% adults struggle with diseases. But because it is a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even rainy day can bring feeling of sadness. Sometimes there is no trigger at all. It just pop out of the blue. These circumstances change and those sad feelings disappear. Clinical depression is different. It is a medical disorder and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you normally enjoy, change in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restless or slowlessness, loss of energy, or recurrent thought of suicide. If you have at least 5 of those symptoms, accordingly, psychiatrically, you are depressed. You qualify for being depressed. Depression has a physical manifestation inside the brain. First of all, there are changes that could be seen with the naked eyes and X-ray visions. These include smaller frontal lobes and hippocampal volume. Or one more micro scale level, the depression is associated with few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian problems, or specific change in REM, slow wave part of your sleep cycle, and hormonal ability, such as high cholesterol and deregulation of thyroid hormone. But neuroscientists still don't have a complete problem solution to it. It seems to have to do with the complex interaction with genes and environment. But we don't have a diagnostic. They can be accurately predict when with the true self. And because depression symptoms are accurately, it's hard to know who might look fine but is actually suffering. According to National Institute of Medicine, it takes average person suffering with mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemical. In extreme cases, electroconvulsion treatments, which is like controlled seizure in patient brain, is very helpful. Other promising treatments like transitional magnetic stimulation are being investigated too. So if you know someone struggling with it, encourage them gently to seek out some of those problems. You might even offer to help with specific things like therapists in the area or making a list of questions to ask a doctor to someone with depression. These first steps can seem insurmountable. If the feeling of guilty or ashamed, point out that depression is a medical thing. Just like asthma or diabetes, it is a weakness of personality trait, and they shouldn't expect themselves to just get over it any more than they could with themselves to get out of it. If you haven't experienced depression, or avoid comparing it to times you haven't felt down. Comparing what they are experiencing to normal, temporary feeling of sadness can make them feel guilty for struggling. Just talking about depression, for example, such shows that asking someone about suicide actually reduces the suicide risk. Open conversation about the mental illness has eroded it and make it easier for the people to ask for help. And more scientists will learn about depression if we go for seeking help from them. Thank you.